Surgical Volunteers International is a wonderful association to help people. That's a primary goal.
We go out, we do free surgeries for kids and adults with cleft lips and palates. We also do things like burn patients.
All of us are volunteers. We gather from all over the world. We bring our own instruments. We use local team to help us gather their patients and let us know what the needs are. One of the other goals is to teach local doctors and local staff.
Surgical Volunteers tries to go to as many undeveloped places as they can.
We've been to Africa, we've been to Morocco, in Egypt,
Vietnam, Mexico.
Lately we've been to Haiti about a year after the earthquake, and we were able to do many surgeries in a very short period of time. When we get there, first we go inspect where we're going to be working. The next day, we have usually a screening of our patients, and the plastic surgeons makes the schedule for the whole week.
We try to do as many as we can for that day based upon the equipment that we have and the amount of patients that we have.
We did about 60 patients in 4.5 days, from 2 months old to 69 years old.
Seeing the little kids, seeing how deformed they were and how much they needed help, and it finally hit me then, and then I realized that it was worth the time.
We have calls from all over the world with a group of people to say, please come here, help us. There's nobody helping us. There is not a single plastic surgeon in the whole country of Belize. Some of the patients that we deal with, they come from the forest, from the rainforest, from the jungles, from the mountains, and they can't even come to the hospital where we are. Sometimes we send people to go get them and bring them here. That care cannot be provided by the local physicians or local facilities. Before we leave, we try to improve the local doctor's professional life. So we don't leave them with the feeling that we just go there, do surgery, and just leave without any backup help.
We want to empower the staff, the nurses, the doctors, to leave them some knowledge of what we do here in America, the techniques that we use, and some of the ways that can help them treat their patients. Surgical Volunteers International wants to expand. They want to reach other undeveloped countries. With more funds, it helps us to travel to these areas to seek places that are in need of our services.
When I see a smile on a face of a child or a face of an adult who's been outcasted for all his life because he had an open mouth and teeth showing, when I give that smile back to that face, I give him the society back. If they're a woman, they can get married. If they're male, they can get a job. This is a wonderful feeling of accomplishment, one life at a time.
It's a good feeling to give, but I believe overall it's a great thing to do for humanity.